Good morning, and thank you so much for joining me today to take the time to learn about your member assistance program. My name is Ida Best, and I work closely with the team who supports the service we provide you. So this morning, I'm going to go through what your program entails, and then I'm going to demonstrate how and where you can access the services. Okay. I will also pause throughout my presentation for questions. So just keep in mind that your video and your audio has been disabled. So for questions, you can use the Q&A feature, which is found at the bottom of the screen. You'll just see a little icon there saying Q&A. And I have a wonderful assistant, Jen, who is going to monitor the Q&A and raise the question for you when the time comes. So a little bit about the foundation of who we are. For those of you who aren't familiar, there's two individuals who founded the company of Inkblot in 2015. A family physician who noticed that his patients had extremely long wait times to access mental health care. And there was also a tech entrepreneur who was personally impacted when a close family member passed from suicide. So together, they identified that there was a gap in the system that was preventing people from being able to access affordable and accessible mental health solutions. So what they did was they built Inkblot on a foundation of evidence-based approaches in order to bridge that gap and ensure that people are able to access the support that they need in a timely manner. And today, Inkblot is a part of GreenShield Health, and that's what powers your program today. Okay. All right. So accessing care couldn't be easier. We've partnered with Alberta Retirees Teachers Association to be able to provide this member assistance program for yourselves, your spouse, and your dependents if they are on the plan as well. Okay. We provide professional and confidential counseling services as well as different support such as health coaching, life transitions. There's even legal consultations and financial consultations that you can find. There's a large scope of services that are able to support you, and they help support your personal lives anytime through this digital approach. So what this means is that these services are available to you through My ARTA Health Hub, which is found on myarta.net. Okay. So once you've logged in, you're able to access care by scheduling appointments at a time that is best for you. Okay, so you are in the driver's seat here. Okay, so a little bit more about our counseling services. So we have a large network of clinicians as part of our platform. They range from social workers to psychotherapists and clinical counselors. They do have a minimum of a master's level degree of education. They're also registered and in good standing with their colleges. And they have an average of about 12 years of experience. So with GreenShield Health, our minimum is 5 years, but on average, with the amount that we're seeing with our clinicians is well above the 5 years. And I also do want to name that we really do value diversity, equity, and inclusion. We can offer counseling in over 30 different languages, and our counselors represent a variety of different cultures and identities as well. Okay. So let's say it's really important for me not only to see a clinician that is specialized in supporting someone with anxiety, but I also want to ensure that that clinician that I'm going to be seeing is Italian. It would be very important for me to have a personal connection with a clinician who's going to be familiar with my lived experiences, let's say, or even my cultural practices. So these factors are in our matching algorithm that I'm going to show you later on, and it takes all of that into consideration. Okay. So before I take a pause, I want to talk to you about finding the right therapist, and then I'll take a pause. Okay. So, what we've done to support individuals and connecting them with the right counselor is we've built this matching algorithm. And we did that in partnership with our clinical team. And it takes into consideration your clinical needs as well as your personal preferences. And based on the answers that you provide during this questionnaire, and the questionnaire can take about, let's say, about 10 minutes, we'll show you a short list of clinicians that are uniquely suited to you. We will go over that like in the demo as well. And you can take your time and you can see those clinicians that we're going to match for you. So it's important to note that, sometimes you don't have the time to fill out a questionnaire and you just want to book an appointment and just talk to somebody. So you will have the option to simply browse the directory as well. And they will give you to the next available counselor based on the next available appointment. And at that point, you can then select your preferences. And then a new list of counselors will reload to the preferences that you selected. Okay, so will have two paths, two options to take. So what you can see on the screen right now is an example of what the clinical profile looks like. We can see the languages that they speak, how they self-identify, and their approaches to care. So you can take your time and look through a variety of the counselor profiles. And once you've decided on the clinician that seems right for you and resonates with you, you can book directly into their calendar. Okay. So I'm going to take a pause here. So Jen, I'm going to ask you to see if there is any questions that are being asked, um, just because I won't be able to assist with that. But just let me know if there's any questions. I'll be happy to answer them.
No questions right now.
Perfect. Thank you. Okay. So we'll keep going. So every year, your spouse, and your dependents, again, depending if they're on the plan, each have access to 5 sponsored hours. And this is 5 sponsored hours for individual counseling. You've got 5 sponsored hours for couples counseling. And then you also have uniquely like 5 sponsored hours for health coaching, 5 for life transitions, 5 for career coaching, and then the legal and financial counseling, that's as needed. So it's basically unlimited. And this number will reset annually every November 1st. Okay. So you are entitled to that. Now, let's say that I've exhausted my 5 hours of individual counseling before the year resets. Okay. So that doesn't mean that I'm not able to continue with counseling. We still offer that long term support. So if I've exhausted my 5 sponsored hours of individual counseling with my mental health clinician, I can continue to book with that same clinician with whom I built that strong therapeutics rapport. Okay. And booking of the appointment is going to take place exactly the same. The difference is that you're going to be prompted to put in your payment information. And if your benefit plan covers counseling, your benefit plan will pay directly to that provider of service rather than you paying out of pocket and having to submit to your benefit plan. So if let's say you do have a co-payment and you have to pay a certain portion of it, well, that's when your payment information comes in handy and you'll just be charged that co-payment, not the full price. So this is done just easily, automatically. It'll have that integration from your EAP hours right to your benefit plan. And I'll show you how it's all integrated as well. Okay. Now, let's say you either whether you exhausted your maximum, let's say on your benefit plan, or you just want to pay privately, you do have access to preferred pricing. So currently in Alberta, clinical counselors, sorry, social workers and psychologists, they charge on average about $200 an hour. Okay, so with your EAP preferred pricing program, all these clinicians, regardless of where they're located or their designation, the rate is going to be the same. So that means that you could have an hour-long session virtually for just $90. Okay. You don't have to pay that $200. You are locked in to $90 virtually. If you want to have a 30-minute session, well, then that session is going to be $45. And if you want to go see that clinician in person, and they do offer in person, that rate's going to be 110. So you'll see that it's quite affordable and cost effective. Okay. I'm going to take a pause just in case there's questions. And if not, we will continue.
There is one question. So
Yeah.
to clarify, 5 counseling appointments are free and then you pay through your benefit plan?
Yes, that's correct. So you will have 5 hours that you will have, which is sponsored, so it's free to you. And I'm going to show you in the demo that what happens is that there's going to be a tally. So you'll start off with 5 hours, and then if you use an hour of it, well, the next time you log in, you'll see that four is available, and it's just going to count it down. And when you're at zero, well, then it's just going to coordinate with your benefit plan, so you won't be out of pocket. It'll just continue on. Okay,
That's it for now.
perfect. Thank you. Okay. So another thing I want to note is that before you begin to access the sponsored hours for counseling, you have an opportunity to have a free consultation with a clinician that you've selected. So this is a 15-minute meet, sorry, 15 minute meet and greet. So it's a virtual opportunity to see if the clinicians are really a good fit for you. Maybe you want somebody who's going to validate you and, um, give you that unconditional positive regard. Or maybe you want somebody who's going to challenge you and call you out. Or maybe you want somebody who's going to provide you with tools and exercises that you can practice in between sessions. Okay. So, this is a really great opportunity to see if this clinician has the right approach of care for you. And if you feel that connection, that trust, and if so, that you can engage and you can move forward with booking them for an actual session. Okay. And let's say for whatever reason you don't feel comfortable, you're unsure, you can just unmatch with them. You can be presented to another list of available clinicians that match you, and then you can have a free consultation with that person too. So, in theory, you have unlimited free consultations with all of these counselors. Okay, until you meet the right one. So that's another feature that we have.
Sorry, Ida, there is a
Yeah,
question. When you
go
say
for it.
provider, do you mean ARTA Extended Medical?
So by provider I actually mean clinician. So whether it's a psychologist, a psychotherapist, a social worker, that would be the provider of service. So it would be the clinician, okay, the person who's offering the services. Okay. All right. So we chatted about counseling, and we can always go back to questions about counseling as well. But I wanted to switch to another part of what's available in your program, and it's this concept of total health and life services. So every year, once again, your spouse, yourself, your dependents who are on the plan have 5 sponsored hours for your health coaching, 5 for life transitions, 5 for career coaching, legal and financial, that's unlimited. Okay. That's as needed. So I'm going to start with legal and financial services, and I'm going to dive into the rest. So legal and financial services can be accessed through the platform. The way that I would define a consultation is specific versus general. So let's say I'm looking to move and I want some general advice on the law. I can call for legal services and they can provide me with general information on, what are my rights as a tenant? Okay. But let's say I have a lease and I want some support and I want somebody to review the lease and tell me, should I sign it? Should I not sign it? And give me some more information about it. Well, that would be beyond the scope of a consultation because in order for them to provide me with advice, they would need time to review that document. So this would be considered more like opening a case. And if you do need to retain a lawyer and open this case, we do offer a 20% off on retaining that lawyer for your legal consultations. Okay. So it is doable. We'll just give you like a rebate. Okay. So I'll just pause there in case there is questions about that. Okay.
Keep going, Ida.
Yep.
I can answer these
Perfect.
questions.
Good, good, good. Okay. So now I want to focus on health coaching, life transitions, career coaching, because this is something that we do a little bit different. So here we triage the requests through an assessment with a nurse practitioner. So let's say I'm looking for support with nutrition. Okay. I'll have an assessment with the nurse practitioner who may be able to provide me support regarding my concern and solve everything in that moment. But it's an opportunity for for me to connect with the nurse practitioner so that, they can get a wholesome idea of my concerns and explore other opportunities that maybe I need support on. So let's say I have a request to support me on nutrition, okay? So during that assessment, I share the reason why I'm looking for support. And it's because, I recently retired and I finally have time to cook homemade meals and focus on my health and my family's health too. Okay. But at the same time, I'm feeling a little lost because I'm not working and I don't know how to fulfill my time and I don't feel like I'm giving what I should be giving. And that can impact my mental health as well. Okay. So through that assessment, the nurse can say, absolutely, let me connect you with a nutritionist to support that need. So that's going to help me with that nutrition need. But also, she might say, well, I want to let you know that through your program, you have support for life transitions. So we have a variety of different life coaches on the platform who can support you and navigate you to meet your goals and also introduce you to different ways of keeping yourself engaged. So we also have career coaches on our platform who can support you if you're looking to get back into the workforce and what does that transition going back look like? Well, they'll support you through that need as well. So there's a variety of life coaches that we have on the platform. So that there in a nutshell is your total health and life services. We are going to move on to digital cognitive behavioral therapy, which is called ICBT. But before I do that, are there any questions around the total health and life services?
Not at this time.
Okay, thank you. Okay, so ICBT for short. It's a little bit easier to say as well. So another thing that we have access to is self-guided. So this isn't going to be therapy with anybody. This is truly yourself and modules. So you get to self-guide yourself. If you're not sure about booking an appointment virtually or in person with a counselor and going through that type of therapy, you have access to this therapeutic program directly from your dashboard at your own pace. So there are 9 modules that you can read through to help identify and challenge your thoughts to be more beneficial to yourself and ultimately change the way you feel, which can change the way that you act. Okay, so in a nutshell, that's really what it's about. It's about mind with feelings and how we do act. Okay. There are 2 different streams that you can take. There is the anxiety stream, and then there's a depression stream. So there's also an opportunity to switch between the both throughout the sessions so that you can access all the different tools and strategies that are in the program. So I've gone it through myself, and there are exercises we can take that we can complete ourselves that really allow us to reflect on ways we act and why do we do that, right? And it really changes us and guides us to change for the better. Okay. So it's very interesting to see, and it's available to you as well.
Sorry, Ida, there is a question
Yeah.
just from the prior slide. Does
Hmm.
life transition cover grandparent relations?
It does. It does. Yeah. That would be one of them, one of the aspects as well. Um, I don't know if there's any details in that question, um, like if they elaborated on it, but I have seen that being covered before. Yes.
Okay, thank you.
Yeah, no problem. Okay. You know what? What I can do as well, if it does help, um, is I can always share a list of the different types of life coaches, life transitions that are a part of it, because the network is very big. And you know what? Maybe we can post that on your channel as well, just to have more information. So we can take that away. Okay. All right. Okay. All right. So I want to stress that this program is completely voluntary and confidential. So the association is not going to know if you've registered an account and if you're using your hours. Your spouse and your dependents, they won't know either. They won't know if it's utilized, or if you're using your sponsored hours and vice versa. Okay, so you wouldn't be able to see your spouse or dependents either. All of these allotments of credits are kept separately. The way that it's done is really through your account. You would have to actually sign up for your own account, your spouse as well, and dependents as well. Okay, so it's really is confidential. I do want to mention that we built this program from ground up. So you can rest assured that the website is in line with privacy standards in Canada, and this does apply to our mobile app as well. All the data is encrypted. The servers that we use are secure. You can download the mobile app through the Apple Store, the Google Play Store, Android Store, depending on what type of phone you use. I would suggest setting up your account via desktop, and then you can easily access your account through your mobile app. Okay. Our support center, and I'll show you how to reach them once I do the demo as well. If you call that number or you email them, they can always help you as well in terms of setting up your account. Okay. The mobile app has all the same capabilities in terms of being able to book and schedule appointments, attend your schedules, your sessions, and you can also receive messages from your counselor, and you can send messages to your counselor as well in between sessions. Okay. Okay. If there's any questions, let me know. If not, we will continue on to telemedicine. So I want to talk a little bit about telemedicine, and then I'm going to go into a demo for you of which is found in my ARTA Health Hub. Okay.
Ida, there
So,
are two
oh yeah,
questions.
go for it. Yep.
What are two streams in ICBT?
So let's say you have a mild case of anxiety or of depression. Those are going to be the streams. So if I select like a moderate anxiety, then they're going to teach me all about anxiety and how I can cope with it through strategies. If I am suffering with depression, like a mild or moderate case, then I'll be able to get some strategies on how to cope with that as well. And they really do have you reflect on examples that you can identify yourself and write down. It's not shared with anybody, but it's activities that you can do for yourself. So those are the two streams once you identify what you're suffering with or how you're feeling. And you will go through a survey as well so that you can pinpoint what is it that you are, what are you going through, whether it's anxiety or depression, because sometimes you don't know. So by going through the survey, you'll be able to identify, okay, this is me. This is what I'm going to go through. This is how I'm going to cope with it. Okay, so hopefully that answers the question.
Another question, what is the name of the app?
The name of the app, you know what? I would have to double check on that one. I might have to get back to you because I just know it as myarta.net. Um, I'll have to see if there's a different name for that.
MyArta.net works.
Okay,
Yeah.
perfect. Thanks, Jen.
Another question, is a laptop or okay, or do I need to set up on a desktop?
Laptop is perfectly fine. It'll work. Yeah. It's more so like a tablet or a mobile app. Um, those are I would use it after you've actually set up your account on your laptop or your actual computer on your desktop. Yeah.
That's it.
Awesome. Thank you. Okay, telemedicine. So, I mean, telemedicine is great, especially when you can't leave your house because you're sick or you have someone who, is sick that you need to attend to, right? I've used it several times, so I really do like this feature. So our telemedicine solution is designed to help you focus on resting instead of sitting in waiting rooms or getting to a doctor's office, right? Or trying to get into a doctor's office, right? So you can connect with a doctor 24/7 and get a prescription or doctor's note without even leaving the house, really. You have a direct connection, like a consultation with a general practitioner. And I'll show you as well when we click on telemedicine how included in your plan, you have free consultations with general practitioners. And it's really unlimited. It's not just one consultation, it's unlimited. If you want to see a specialist, let's say like a dermatologist, you will see that there's a fee that you would have to pay out of pocket. Okay. It's there if you want to use it, but it's not included into the plan. It's just a general practitioner that's included. Okay. So you can get a consultation within minutes. The wait time on average I see is about 7 minutes at this time. And just to let you know, let's say as you're waiting, you could do something else and then you'll get an alert saying, hey, the doctor's ready for you now. And then you can go and have your consultation virtually by video or even just by chat. The chat function works very well. Okay. And you can use this on your mobile app or on your laptop. They'll give you medical advice, diagnosis, treatments, including lab requisitions as well. So then you can take that paperwork and you can go to get your blood work done, let's say, and then it'll be assessed. So we do have dedicated, skilled Canadian licensed general practitioners that are available on the platform within that network, and they are committed to providing safe and effective medical care. Okay. Now, 9 out of 10 patients have their issues fully resolved on the first interaction. So, general practitioners can effectively treat many acute issues and chronic conditions, and they can do it virtually. Now, keep in mind that, sometimes there's certain conditions where you have to see a doctor in person, okay? And that's why 9 out of the 10 say that they're fully resolved. The best thing you can do when you're using this service is, and I'll show you, like you can select your treatments, but if they're not applicable to you, you can select other and then just try to describe as much as you can what is it that you're feeling, because that will help the doctor really understand, okay, can I treat them virtually? Or is this like, nope, sorry, you have to go in to see your doctor? So the more notes you enter, the better that is as well. Okay. Okay, so now what I'm going to do is I'm going to stop sharing, and let me know if there are any questions, Jen,
Ida,
if
there is
as
one
yeah,
question.
go for it.
Do physicians have access to Connect Care?
So Connect Care, can you describe what that is? Jen, do you know?
Connect Care is where the doctor can kind of see their history of what the patient has received. So any lab work or any services they've received.
You know what? I'll have to get back to you on that one. Maybe we can share that afterwards because they don't tap into a network to see what your history is. It is like the first time they are seeing you. So they wouldn't be tapping into that. But on your profile, you'll be able to see any lab requisitions, any notes. So that is what's available to the doctor and to yourself.
And there's a question, can you access this out of province?
Yes, you can. You can access this out of province, even yeah, while traveling, let's say. The only thing that is not possible is getting a prescription prescribed. Okay. So you can have a consultation, but you won't be able to get any medication prescribed due to licensing. Great questions. Okay, so I'm just going to log in here. And here we go. So I'm going to share my screen.
Sorry, Ida. I
Go
did
for it.
get confirmation that the doctors we do use have access to Connect Care.
Oh, awesome. Okay, great. Less of a follow-up for myself. Okay, great to know. Thank you. Okay. All right. So I'm on myarta.net. And so in order to access this program, what you have to do is you just have to click on My ARTA Health Hub up here. So I'm going to do that. And then right away, and this is a demo site, so I do apologize if it's going to be slow. But I do have, so I'm going to show you in general that this is like really your one-stop shop. This is also where for your benefit plan, where you're able to check your coverage, submit a claim. You'll be able to check your claim history, and you'll also be able to see if you have any drug authorizations that have been submitted and there's a response back. So this is your benefit plan right here. And then when you click on care services, that's going to be your sponsored hours for mental health, telemedicine, as well as your total health and life services. Okay. So what I'm going to do right now is I'm going to click on, actually, you know what? I'll start with here. I'll start with your total health and life services. So once I click here, well, you know what? I'll just take another route because I don't want to have to get kicked out again. So I'm going to go to counseling. We'll start with your counseling services. So this here, the reminder is that you have 5 sponsored hours. Your spouse has 5, and dependents as well. So this is what I was talking about with the 2 options that you have. If you are in need to, get to a counselor right away, and you don't want to have to go through the questionnaire, well, that's when you go to browse our directory. So I can browse counselors and it's going to tell me right away, there's going to be a pop-up saying, are you in a crisis or feel unsafe? Because if so, you should be contacting the crisis line or 911 for assistance right away. You don't need to wait the next day. You need to get service right away. So if that's the case, you stop, you call 911 or the crisis line, which is telephone numbers there. If you're not, and you can wait till the next day, click on continue. Okay. You're going to have to confirm your personal information, emergency contact as well, and then matches are going to load, and it's based on. Sorry, I'm just going to see here for a second. Yeah, okay. It's just going to be based on the first available appointment. Then sorry, the next available appointment. So these are profiles of counselors that are available. You'll see that what designation is, their specialty. So that's going to help you decide who you want to see. But you also can select preferences. And then the preferences are based on modality. So do I want video? Do I want phone? Do I want in person? Because I'll be able to choose that. I can select both of them if I want. If gender identity is important, please, you can go ahead and select that. Lived experiences or identities, you can select that. Specialty, if you feel like, okay, no one really says trauma, so I'm going to select trauma and reload every counselor that is a specialist in trauma, you can do that. Languages you can specify. So you have to select English or French first, and then you can go into a secondary language. Diagnoses, approach to care, and then general availability. You can select these. And if you do, you apply the preferences, it's going to reload some matches for you, and you'll have the profile right there. Okay. Now, let's say you do want to go through the questionnaire. You've got about 10 minutes. You can go through the questionnaire and it's going to ask you questions about your well-being, about a self-evaluation, and then you can continue on with the question. So for the sake of time, I'm going to do this really quickly, but I want to show you where we're going to end up to. And you're going to end up with the clinical profiles, but this is where in the background, it's going to do that matching algorithm to find the unique suits for you. Okay. So you're going to get questions like, looking back over last week, including today, help help your care provider understand how you have been feeling by rating how well you have been doing in the following areas of your life. So the left is going to be less, this is going to be, better. So better for worse. So you can go ahead and select how you're feeling in terms of your family, close relationships. And then again, this is just because, if you have that time and you really want to get a sense of getting your thoughts out. You're going to do a self-evaluation. So in the past 2 weeks, how often did you feel that you had nothing to look forward to? None of the time, some of the time, good part of the time, most of the time. So you can just select what's applicable. Okay, how often do you feel the life was meaningless? How often do you feel scared without any good reason? How often do you feel that you were close to a panic? How often do you feel hard to relax? How often do you feel intolerant or anything that interrupted you? How often do you feel guilty about substance abuse, whether it's drugs or alcohol? Okay. Select any statement that applies to you. So how are you feeling? You can select more than one as well. Okay. How have you been feeling? You can select more than one, as I mentioned. Here we go. You're going to continue on and on. Okay. And then choose multiple or skip this one here. So depending on your situation. And then you're going to go into diagnoses and to stressors as well. So if you do know what is it that you are feeling or have been diagnosed with, go ahead and select it. If it's other, you can select other and put more information. Okay. Any other factors causing distress? Okay. Could be, there's many, many options. If they're not there, click other, specify. Where do you spend most of your time? Okay. And your personal details, you're going to go ahead and you're going to confirm that these are your details. And then your preferred language. So as I mentioned, you have to select French or English. Okay. And then if you want more options, you can definitely go and you can select whatever is most appropriate to yourself. Okay. I'll just select Greek for now. You're going to select specialties that you would prefer in your counselor. Lots of specialties are definitely going to come up here. What therapeutic approaches would you prefer in your counselor? And then spirituality and religion. Okay, you can specify that as well. And this is really just means so that they're more personal to you. You have more of a connection with them somehow. And then there's gender identity. If you want to select that, you can. And then what of lived experience or identity would you prefer a counselor to have? So if there is one, perfect. If there's no preference, you can select no preference. Racial ethnic background, you can put that as well. If you don't have anything, you don't have to specify. You can just continue on as well. And then general availability, right? So when do you have availability? It might be all the time. And if that's that case, then you can select them all. Okay. Now it's going to load my matches. So it's going to take into consideration everything that I've input into this questionnaire. And it's going to load for my preferences. And you can see here all of the stuff that I've already entered, right? So this is what it's looking for. And here we go. And then I can go ahead. Let's say I'm going to see this one. Next available is Saturday. Select my counselor. I'm going to put my phone number, click on next, and then I'm going to have an appointment that I'm able to schedule into their calendar. I won't be able to continue because it will actually schedule an appointment. Um, but it's just a matter of a click there, and then you've got your appointment. Okay. Any questions on that?
There is one question. When you are choosing a physician or a counselor, does the profile give you information about education, experience, etc.?
It will give you their designation, so you see kind of what master degree they do have, but it doesn't tell you where they've worked, their experiences in terms of who they've worked with. It doesn't specify that. You only see the designation and what they've mastered in. So the approach to care, that's the only thing you'll be able to see. So in terms of experience, it depends on what you're looking for, but for experience, you'll see what they specialize in. Hopefully that helps.
Thank you.
You're welcome. Okay, so that really was counseling. And you know what? Actually, before I do that, I'm going to show you something. Sorry. So if I go to my counseling, and you know what? Let me go ahead, browse my directory. I'm just going to pick somebody here. I want to show you what your profile is going to look like afterwards. I wonder if I'll be able to just put a petition one in here. No, I won't be able to. Okay. What I wanted to show you, and I think it's just because I don't have the availability. Here, let's go here. So I'm gonna look at my dashboard for counseling. There we go. Okay, this is what I want to show you. So under your mental health counseling, you're gonna see a dashboard. This is here where you're going to see your 5 hours. So that's how much you have remaining. As you have your counseling sessions, um, and let's say they're half an hour or they're an hour, it's going to be deducted and you'll see how much you have left. So that's how you'll know um, what is left for individual or for couples counseling. And this is per person when they sign into their own account. Okay. There is always going to be a telephone number in terms of getting support from our contact center to assist you. And the first option you can choose with this telephone number is a crisis option as well, if you are in a crisis mode. Okay. Okay.
Right, Ida,
Um,
I'm just going to
yeah.
ask you a quick question before you
Yeah.
move on. Can you complete an assessment now and later on when you feel like you want to make an appointment, will all of your choices be saved?
Yes, they will. So let's say that's a very good question. So let's say I'm in the middle of the questionnaire and okay, I don't want to finish it. It's going to save where I'm at. And next time I log in, it's going to say, hey, do you want to start from the beginning or do you want to continue from where you're at? So it's going to take into consideration your assessment where you started. So you don't have to start from scratch. Okay.
Thank you.
Yep. Okay, so total health and life services. Hope they don't get booted out again. So this one here is going to detail right here exactly what I mentioned before. You've got your career, your health, life transitions, legal, and financial. It's real. This one here is really simple. You really just click on it. You start a request, and you give it a reason. Like, what is it that you're looking for? And if it's not there, you can select other and specify it. So let's say I want, nutrition for weight loss. I can click on next, select the province that I'm in, and then describe what is it that I'm feeling or looking for. I click on next, and then I'm just going to get an email back from the nurse practitioner who's going to schedule an appointment with me. Okay, so it's pretty straightforward. There's no surveys or questionnaires. It really just is a direct request, and then you'll get contacted. Okay. Okay, telemedicine. I'm going to switch over to telemedicine. Oh, look at that. Everybody loves a demo account where you always get booted out, eh?
Sorry, Ida, there is a question about how does a
Yeah.
spouse create a profile and access the services?
For the total health life services and sorry, the total health and life services and counseling, that part of it. You can there is a sign in portion of it. You know what? I might get to it right now, and I can show it because you would have to just actually, you know what? I am going to stop sharing. I'll just restart so that you'll see where you have to sign up. Okay, let me see here. And these are all good questions, so we can always send like follow-ups too to everybody so that they have this. Okay, I'm just going to share my screen. I want this one here. Okay. Okay, so if I go to the main ARTA webpage, my ARTA login. Okay. Oh, I think I have to sign out. There should be a registration. You know what? I might actually get back to that just because the my ARTA um, net is a little bit different than the network that I actually work with. So why don't we send a follow-up on that and instructions on how to register accounts? Okay.
Yep, no
This way
problem.
it's a true source. Okay. Because if I don't want to sign out and sign in and yeah, I'll just get booted out again, I think. So let's see here.
I'm just going to interrupt you with one more question.
Hmm.
Can you convert individual counseling to couple counseling and make it 10 hours of couple counseling?
Fortunately, you can't do that. It's strictly the 5 for each. Yeah. Okay. All right, so let's see. Okay, we're at telemedicine here. Okay, let me give this a try. Okay, here we go. Okay, so with your telemedicine dashboard, I'm just going to quickly run through the menu list. You'll see your dashboard, which is really just everything in one clear view. So, for example, if you're prescribed prescriptions, you'll see them all listed here. If there was doctor notes, you'll have them listed. Referrals to see a specialist, you'll see them listed. Lab requisitions, okay, or care recommendations. So anything that you're getting from your general practitioner through telemedicine, it's all going to be in this one dashboard. Okay. You can click on talk to a general practitioner, book a consultation, or click book a consultation here. So there's different avenues to find it. Consultation summaries. So after you're done your consultations, they're going to post a summary so that you have it. So you have it all recorded for you. Okay. Your inbox is if you're going to get a message from your doctor. Telemedicine profiles. Basically, this one here is you can add any family member. So if they're not on your benefit plan, and you want to add them because you feel like, you know what, we're going to get a consultation for, oh my goodness, it could be like, my mother-in-law, for example, right? She's ill. I help her out. I assist her. Well, then I can actually add her to my profile, or let's say my niece. I can add her to my profile and I'll be able to get the consultations for her. Okay. So this is a really good feature for that purpose. And then telemedicine settings is just like your preferences in terms of alerts, notifications, languages. Okay. So if I go back to the dashboard and I go to talk to a general practitioner, if there's someone else in your care, that's when you can assign them a profile. But let's say I'm Art. I'm going to select myself. Um, Select the country, your province, continue to specialty. This is where I want to show you. So you see how general practitioner shows covered under your plan? That's how you know you don't have to pay out of pocket anything. It truly is covered under your plan. And then if you see like a dermatologist, for example, well, really you're gonna have to pay the 199 out of pocket. Um, so that's something that you can, or if an endocrinologist as well, $230. So that's gonna be out of pocket. But what is covered under your plan is your general practitioner. Okay. So I'm gonna go to continue. Okay, this is where you can specify your symptoms. What is it that you're feeling? The majority is on here of what you would normally want to see a doctor for. But if not, click on other and describe it. Okay, you will also have an opportunity to describe your symptoms more in this channel as well. Actually, you have to put a minimum of 25 characters in this section to move forward anyhow. Okay, so I'm going to put, I have a throat. Let's say I have a throat infection or something, maybe like strep throat. I don't know what it is, right? I can select, I need a prescription because most likely I'm going to need an antibiotic, but I don't know the name of the prescription, and that's totally fine. It's just optional. Okay. And then what are you feeling, right? Well, you can put like, I have a burning sensation, let's say, right? Um, um, oh, yeah, like anything you want, right? So I feel burning, irritation, can't swallow. So at least it has to be about 25 characters required. Okay. Continue to confirm the details. So this is what I wrote, and then I can continue to the provider pairing. Okay. I'm just gonna wait here to see. And then what happens is that they've sent the request to the network, and now I'm just going to wait. Okay. They do want you to upload your health card. So you can just upload that so that they see that you do have coverage. If you have any other health information, you can specify it as well. And then as the doctor is available, you'll get the notification and then you can start chatting. I'm going to cancel the request just because we don't need to bog the doctors down. Okay, so that in a nutshell is telemedicine. I'm just gonna go back to show you where you can actually call. But if there's any questions, please let me know.
Right, Ida, I'm just going to stop you for a second.
Yeah, yeah.
There are some questions about how dependents can sign in. And I'm going to put instructions in the chat on how dependents can access their virtual services.
Awesome. Okay, perfect. Yeah, I think that's good information to share, even if it's a spouse or dependent on how to sign up, because then they'll have everything detailed. So that's a very good point. Good. Jen, do you have for spouses as well, registration?
Yep, I'm going to put all the instructions in the chat.
Awesome. Okay, good. Okay. Okay. So one last thing I really wanted to show you as well is like when you're in the main page, there is the button called support. So if you click on here, there's a help center that is really just, it's FAQs, okay, that can really help you even on actually, it's funny that we're saying this, even navigating the dashboard, how to view information. So how to create an account for dependent. Isn't that funny how we're just talking about that? So everything is actually here in terms of how do I get started on my ARTA Health Hub, right? How do I register? How do I see things, right? There's a bunch of other FAQs for your insurance and your benefits, not just for your EAP program, but in terms of, what's a DIN? How do I create, how do I get an estimate maybe for dental? All kinds of stuff like that. So there's several FAQs. They're all specified by category. So if you want your benefit plan versus your mental health support, total health and life services, telemedicine, everything's there, which is really great. So if you don't want to, if you have time to call, check out here. If you rather talk to somebody, that's no problem. If you click on contact us, there's going to be two numbers that we shared with you. So if you have questions on your dental insurance benefits, drug claims, extended health benefits, this is the number that you call, the 1-855-444-ARTA. If you have questions on your mental health, sponsored hours, telemedicine, everything that I showed you today, this is the number that you call, the 1-833-707-4747. This is also gives you the option one for your crisis support. Okay. The crisis support, you will get a response, by the way, if you are in a crisis. There is no wait time. You will get assistance. Even if you did not have any coverage at all, you will still get assistance. Okay. So that's a very good option to have as well available. Yeah, and I think that's really about it. I'm going to stop here just in case I have to show it anything else, but this does come to basically the end of my presentation. And I really appreciate, you all joining today to learn about it today. If there's any questions, I can definitely hang on and answer them or try to answer them. Okay, I think we're probably good then, right?
Sorry, there is one question.
Yeah.
There was a question about if not a dependent, do dependents get discounts for counseling and legal services?
If they're, I didn't get the top of
If
it,
their
the
if their
dependents.
dependent is not on the benefits plan.
If they're, yeah, they wouldn't get, so those hours are specific to for dependents who are on the plan because it's going to track it, right? If they're not on the plan, they won't be able to have an account. So they won't be able to get the service. But it doesn't mean that the plan, the plan member or the spouse can't ask that consultation question, right? That general question for assistance. Yeah. Because it's not like if they're opening up a case, right? It's just a general question. So the plan member or the spouse would have to ask it. The dependents would not have any services. Questions that are available?
I can answer the ones that have come in. So just anyone that's waiting for a answer to your question, and I'm going to put instructions on how your spouse can
Perfect.
access the virtual services. I'm just going to put it up in the chat here.
Awesome. Okay. And of course, if there is anything else that comes up, Jen, you know how to get a hold of me, so I'll be able to answer them as well.
Yeah, if anyone has any additional questions, they can always email info@arta.net, and I'll put that email up in the chat as well. And you're always able to call ARTA with any questions. ARTA.net also has some really great information about our virtual services as well. So thank you to Ida for presenting to us today. And this video will be posted on our YouTube channel so you can access it and rewatch the information whenever you would like.
Great. Well, thanks everyone for your time and have a great rest of your day.